Practically impossible to do anything in my house that involves quiet unless I'm actively working. So outside of work hours, we get kids. So this is my week 3 module, and I didn't actually have to do an experiment for this because when I was watching the Operation Asha video and actually went onto their website a little bit afterwards, and in reading this assignment, I've actually created something in my community that we started in 2008, which is the Coachella Valley Dog Club. Obviously not to the same level of impact. However, it is specifically geared to the most at-risk populations. So those are low-income minority populations in our area that are majorly affected by a complete lack of access to evidence-based training and behavior resources and support. And those are the dogs that most often end up in our shelter system um, because it's unrealistic to expect people to pay the industry standard um, charges for training and behavior help. And because we don't want them to end up back in the shelter, we created the Coachella Valley Dog Club. I guess if you're applying the 4D model aspect of it, the discovery portion was realizing that there was a need, that we were having people leave the employer that I was at the time. And um, we wanted to be able to make an impact with people as well as animals. For Operation Asha, they focused on who had the most need and how they could realistically get that need met, how they could change the care gap for tuberculosis patients, and they could help essentially end the pandemic in their area. And they understood the trajectory of the lives of those who they were trying to affect. I was a vet tech and a dog trainer. I was sick of participating in behavioral euthanasia and overwhelmed by the number of dogs that were being sent into our shelters. And so I had this kind of dream of creating a training and behavior option for people that didn't cost them anything, or it would cost them something very minimal. And so I started out, I didn't know what a 4D or a 5D model was. I had really no business skills at all. And I launched a community-based program that offered free and low-cost training services to at-risk communities. The execution of it was a little bit different. So when it comes to the design aspect, it was more done by need. So like the curriculum and everything I understood how to do, the rest of it was just making sure that we had, the registration forms done, that we were able to collect data to see how it impacted. I did have 2 friends who worked on this with me in the very beginning. There was never a focus on what skills, we didn't have in needing to build those skills. It was all taking the skills that we do have and putting them to use. We did follow-ups. We sourced information on each family, and we followed it to determine, how the training impacted them short-term and longer-term. We also looked at the shelter numbers to see if we were actually making an impact in the number of dogs that were being relinquished for behaviors. And we connected with local shelters and rescues to provide staff and volunteer training, as well as resources to adopters, connected with colleagues outside the area who are already working in shelters just to kind of expedite paperwork and curriculum options and get more inspiration to make it a more worthwhile and fun program. And we networked vets offices to provide information and resources for their lower income clients as well, because people that are coming in that are saying, hey, I have an unruly dog, but all I can really afford is food and the shots right now. I can't afford to spend a whole bunch of money on training. They now had an avenue. I guess our destiny aspect of it is moving forward. We now have in 2022 a shelter to service dog program, a rescue rehab training program for shelters and rescues, Project FAS, which is for daycares, which is lowering fear, anxiety, and stress levels. We have bite prevention that is taught to children in schools and programs after school, as well as people who bring their dogs into their offices. And then we have therapy dog program. We actually go to our local community college during midterms and finals. We also have grant and scholarship programs that have specific targeted groups that can get a huge impact financially for training and behavior services. And if you adopt from one of our local shelters, the one that has the most humane standards, you do not have to pay anything for our services. And we've been growing strong for several years now, and I love it.